Welcome in, everybody. My name is Kiera Long, and I'm the program manager for the National Roundtable on Cervical Cancer and the National HPV Vaccination Roundtable. And I hope you enjoyed the first round of roundtable talks. It was fantastic to hear your ideas, and we can't wait to learn how this developed invaluable tools that we are bringing to the table. We want to make sure that these are shared effectively with you. It is now my pleasure to introduce our next speaker, Dr. Liora Sahar, a geotechnic engineer and GIS professional with experience in research, industry, government consulting, nonprofit, and military domains, specializing in data analytics, geospatial sciences, remote sensing and algorithm, and software development. She has a lot of a lot of experience. Liora led the geospatial solutions team at ACS, which actively participates in research projects and supports the daily activities of ACS programs, pillars, and regions. Dr. Sahar provides leadership and expertise and operational support within ACS and to its partners, focusing on the integration of geographic information systems and science within the organizational projects and research. Thank you, Dr. Sahar.
Okay, thank you. Okay, there you go. Is my video on? Yeah, there you go. Okay, that was very long. Thank you so much, Kiara. That was so kind of you. Thank you, everyone, for joining that session where I'm going to talk to you about GIS of the American Cancer Society and introduce you to a new tool that we're making available to all of you through the National Cervical Roundtable. Before I'm going to start, I would like to acknowledge the wonderful geospatial solutions team at the American Cancer Society, as well as thank Shelley Dusick for working with us an entire year almost to make that tool and dashboard available to all of you. So GIS stands for Geographic Information, System Science and Services. And although we are a very small team, we work across the spectrum of all of those different components. We engage in research, we develop different tools, maps, and I'm going to share with you some of those, some of that work and how you will be able to utilize that in a second. So GIS is really answering the question of where is the burden of cancer? Where are our resources? Where are people with cancer that we would like to provide those services and make sure that they have access, right? Where are the survivors? Where are the caregivers? Where are the health systems, screening locations? So when we bring all of that together, we can start talking about large amounts of data that together, when we structure those and we process, we can elevate that to information, right? And then knowledge. You've seen those. Wisdom was added not that long ago. We're not that wise. We can strive to get there, but it's all about evidence-based decision-making. That is what the geospatial team is all about. How do we take data and have data drive decision-making, and really all about taking research outcomes analysis into action. So I would like to quote Dr. Bob Smith, who is the Senior VP for Cancer Screening at the American Cancer Society, that last year in one of our conferences said something so simple but so profound. It was in a discussion with state-based initiatives, and he said, you need to know your state, right? And GIS and geospatial techniques, methodologies, visualization have a way of easily allowing us to explore and to get to know the state, the region. If you're working nationwide, then what are those different gaps? What are those different opportunities? How can we use all of the data to further explore, to understand our communities? And of course, we can talk about what is the geography of the community, but that's another philosophical question. But how do we bring all of those data sets together to really drive action in our geographic area? So I will start actually not with the dashboard, but this is a screenshot of a dashboard that we developed for ACS team that we're working with our partners in San Diego. And when they received this new geographic area and started to explore what kind of programs, how should we address gaps, identify gaps, and deliver the right programs, the relevant programs to those communities, we provided that dashboard. And in this one, you can see 4 different maps. And even without knowing, you have the legend in front of you, but even without knowing really what those different layers are telling you, you can see that there are different trends and patterns that emerge when you look at all of those different layers together. And that's really the strength of good visualization. So in this case, you see at the top left, educational attainment. You can see this corridor where we see higher vulnerability using the CDC Social Vulnerability Index. This one is poverty. And here you see different predominant racial and ethnic groups. So bringing all of those data sets together help you to start thinking about those different patterns and where you would like to go and further explore what other data sets, right, you would like to look at in order to make sure that you tailor those programs to those communities. So with that in mind, we launched this project that is the cervical cancer data dashboard that is provided to you. It's on the cervical cancer roundtable website. And the first thing that you do, I know that I do, I go to Cancer Facts and Figures, a fantastic resource from the American Cancer Society. And when you look at the cervical cancer page, you start to identify the different risk factors, those social determinants of health. We also heard in all of the sessions this morning about different factors that should be taken into consideration. We heard about, health disparities. We heard about poverty and other different risk factors. And that's how we started to identify what layers we want to actually include in the data dashboard. And with that in mind, we've identified all of those different layers and categories of layers. So for example, you can see surveillance data. You can look at surveillance data, of course, from NCI and CDC or from state cancer profile, screening rates that are available from using BRFIS data. We both provide you data at the county and the census tract level from the CDC Places project, also estimates at the state level that are provided to us by the American Cancer Society Risk Factors and Screening Research group. We added the National Breast and Cervical Cancer Early Detection Program location and different demographic, socioeconomic, and other factors from the census and the American Community Survey that have been pre-processed and provided to us as GIS layers by the Esri demographics team. And this is how it looks like. And I'm going to have a very short demo in a second to show you exactly how those layers look like and how you can interact. But for example, those are the state level screening rates as provided to us, as I said, estimates from the American Cancer Society group in our discovery pillar. And you can see the different variables that are available to you. This is a screenshot from Places. Those of you that are not familiar with Places, fantastic small area estimates that are available to you for different health outcomes and prevention. We are consuming their cervical cancer screening estimates at the county, at the census tract and zip code levels. And really, when you think about this very simple dashboard, you can do a lot of things with that. For example, we allow you to view 2 maps. So not the 4 that I showed you a second ago, but at least 2 maps at the same time. You can look at different graphs, for example, of mortality and incidence. You can work nationally. You can select one or several states, and you can explore additional data that is provided to you using, for example, pop-ups, as I'm going to share with you in a second. Very important, always remember, we provide a lot of information about the source of the data. Of course, credit to those other wonderful organizations and agencies that are putting a lot of time and effort into providing some of those layers. And then a tutorial video for you to start working with that dashboard. So this is, the dashboard is not going to provide you probably everything that you need for every project, but it would allow you to get to know your state, to get to know your county, to get to know your geography, to explore, to ask questions, and then dive deep. Do I need additional data? Do I need more granular data? And really, as I said, it's all about gaps and opportunities, and eventually your call for action. So this is how the dashboard looks like. As I said, I'm going to show you a short live demo in a second. You can go and look at one specific state and start looking, for example, with the two maps. That's a great way to identify, for example, oh, which are those areas where I have high mortality, relatively high incidence, low screening rates. Here in, for example, in Florida, you can start looking, this is the number of females, ages 25 to 64, you can look at median household income and start identifying those patterns of where do we have higher mortality, high incidence, low screening. And then those are the pop-ups, for example. This is how it looks like. And then you can start and look, for example, insurance coverage, right? And if you want to further explore, for example, what's up, you know, what you're looking at the county, but you really want to, in some cases, if you can, and if we have the data, look at sub-county variation. So if we're looking at those two counties here, this is, I believe, Polk, then you can see the sub-county variations when you go down to the more granular census tract. And then you can put together, this is from my PowerPoint, but taking those two, you know, each time two maps and showing how health insurance, screening, median household income, educational attainment, actually, if you need a report, for example, for those areas or to understand differences between different communities. So I'm gonna jump to a live demo in a second, but remember, the GIS team is here to help. This is our email address. Go explore, come back to us with questions and comments, and this we're gonna keep on. This is a dynamic dashboard. We're gonna keep on changing and improving, and we really wanna hear from all of you. And again, thank you to my wonderful team. This is how the dashboard looks like. So I don't have a lot of time, but there you go. Here is, for example, where you have a collapsible panel where you can go and use the different links to go and read about all the different sources of the data. Very important, there are different nuances about, for example, the ages of the different surveys, if it's births, and the data that is collected by different agencies. So go and explore that. On the main panel, this is how the landing page looks like. So for example, here, very easily you can go and change, for example, the background of the map. You may find that very useful, for example, when you're creating proposals or presentations for your look and feel. This is where you can look at all the different layers that are available to you. There are different groups of layers. So for example, here there are different demographics data. You can toggle on and off the entire group. Here I'm gonna, for example, add educational attainment, and I'm gonna remove, I had cancer incidence before. This is, for example, screening data. And this is your legend. This is how you're gonna understand what those different colors actually mean. You have here graphs of incidence and mortality, and you can go and you can select one state or several states. Everything is gonna be filtered, as you can see here. And then you can also see, for example, screening rates. Everything was filtered to the state of California. And now your landing page actually is showing you incidence rates. So here are incidence rates for the state of California. Here are, this is educational attainment. Let me change here the last thing that I'm going to show you. For example, if you would like to look at educational attainment and let's here look at health insurance. First of all, as I said, if you click on any feature, there's going to be a pop-up based on some of those we've created. Some were created by the organization or agencies that actually created that layer, and you can read more about that specific, get more information. And the one thing I want to show you is when you are starting to zoom in, this is where there is this, I heard some people call it a little bit of a disconnect, but this is where you move from the counties, for example, to the census tract layer. The last thing I'm going to share with you, just in a quick second is, for example, incidence mortality is always going to be at the county level. If you click, the pop-up opens, and then you can read more and actually also see the average annual count, the number of deaths and trend, and the not just the mortality rates and incidence rates, but also the counts. The data is also available to you from the pop-up. So I will stop here. So we have a couple of minutes for questions. And thank you so much for having me today.
Thank you, Dr. Sahar. I really appreciate you coming out and introducing everyone to this fantastic new resource that's on the ACS NRTCC webpage. We have a couple questions for you. One is, we are located at the intersection of 3 states. Does the dashboard allow you to select by counties or just by state?
Just by states, I'm sorry. If this is, there are ways of doing that with the dashboard. If this is a request that we are going to see that is common and many people are going to request, then we can make adjustments to the dashboard. So please reach out to us, and to those of you specifically that need additional maybe GIS assistance, please reach out to us. You have our email. If we can help you, I promise you that we will.
Okay, and then one last question before we hop into our other session, and that is, will data related to self-collection be available on the data dashboard?
If I can get the data, I will make that available. If our team gets the data, we don't have any data about self-collection. So Shelley, I will look to you, to our different partners, and all of those different wonderful organizations that we hear from today. If the data can be made available, definitely our team can make that available on that tool as well.
All right. Thank you, Dr. Sahar, very much. We look forward to that. If you are a participant and you know of a data source that you would like to see made into a section of our data dashboard, we are very interested in hearing from you. And we would like to talk to you about how we can use this tool to grow and best meet your needs. Next up, we have Courtney Van Wert. She's going to talk to us a little bit about some of the networking challenges that we have going on. And for those who are leading roundtable talks, if you'd like to join me for tech checks at 2:30, you can get into your roundtables and I will come around and help you get set up. Thank you all very much. Appreciate your time. See you in the next session.